Hi, everybody. Welcome to the Unseen ADHD podcast. My name is Isabel Christian.
My name is Pranati Rapasad,
And my name is Nikari Neeraj.
and today we have a special guest speaker with us.
I'm Colin Bass, and I am a physician and psychiatrist at UT Southwestern Medical Center in Dallas.
Thank you so
Okay,
much.
wonderful. All right, so we have a few questions for Dr. Voss. I'll start us off with the first one. So, how does ADHD often present differently in high-functioning individuals compared to common stereotypes that most people have?
But I understand the question is high functioning, meaning more highly intelligent. Is that the question? Okay.
Yes.
So, to start off with, the percentage of people with high intelligence having ADHD is about the same as those with normal or average intelligence. So, it's prevalent. That's a fact. It's often diagnosed later if it's the inattentive type. So if the person with high intelligence is having behavioral abnormalities, hyperactivity, speaking out of turn, disrupting the classroom, they will be picked up earlier by teachers and by family members. And I guess by definition, they will not be called high functioning. They're high intelligence. Now, if they have the inattentive type, where they're not paying attention, they're not able to what we call have good executive functions, like focusing, short-term memory, planning, shifting focus, they will slide through because their intelligence will help them prepare, even though they prepare less than the average intelligent folks, they will still be able to get passing grades or even high grades. Well, they begin to hit the wall sometimes in high school, sometimes in college, and sometimes in postgraduate college. For example, at the medical school where I teach, there are people who have come through high school, college, they've been able to pass through, make it into medical school, and then they hit the wall in medical school. So the inattentive type in particular are folks who are going to be uh, diagnosed later in life. So your question has to do with like how do they present differently? Like what do I see? What do physicians see? What do teachers and other people see? Uh, and this has to do in part with the clinical features or the symptoms or the criteria of ADHD. So if you take out the hyperactivity and the behavioral symptoms, and you're looking at the cognitive symptoms, the person with ADHD, high intelligence or low intelligence, often has difficulties with time management, with organization, with turning in assignments on deadlines. Uh, they're often anxious and restless inside. They tend to procrastinate. Sometimes the word time blindness is used. Uh, they don't estimate how much time is required. They may show up late to school, late for the job, late for appointments. And so to cope with these problems, the highly intelligent and the less than highly intelligent can do better if they have a structure and if they have support and if they have a system in place. So if you have um, coping skills that you can manage time with, manage your study, your assignments, etc., you're more likely to succeed. But if they're on your own, especially when it comes to like when you've left when the student is left to go to college, for example, now they have less of the structure and less of the support. They are going to have to maybe over prepare to and impose a structure in order for them to succeed and make it. Sorry. I hope I've answered your question. I'm open to a follow up if there is one.
So I guess a follow-up to that question would be, a lot of these cases are high achieving students are very overlooked until adulthood. So would you further explain on why there's a lot of overlook to those cases until adulthood?
So the hyperactive, disruptive kids are not overlooked. The inattentive type, people misattribute why they're not doing so well. So parents and teachers may identify this person as they have so much potential, and yet the grades aren't good. But the people will misattribute their lack of high performance. They're not performing high because they're anxious or they're lazy or they're perfectionistic or they're forgetful and or they're depressed. And so because it's not visible, other reasons get attributed, other illnesses to why is this person not as successful as they could be.
So,
So,
so
just to go on from that, so from your clinical perspective, what would you say that compensating for these behaviors would look like in these unattentive individuals?
Okay, that's a great question. So, as I said, the teachers and the parents and the families can impose a lot of structure. They can have tutors, coaches, really kind of hand holding, support, checking in every day, every week. What do you have to turn in? What are you preparing for? How many more days left? But let's say the parents are too busy and the school's not identified these kids. So these people are on their own now. So what do these people do is that they create that structure. They create the timelines. They become the ones with reasonable self-worth. They know they can do it. They know they have it in them. They have to work twice as hard as the other people. So number one, they're working extra hard. Number two, they're more than elaborate. They've got spreadsheets, they've got timers, they've got calendars, they've got reminders. They're double checking things so that they don't miss things. So that's how they cope. But there's a cost. If that's part of your question, there's fatigue, there's anxiety and stress. What if I go wrong? They may avoid things that are just overwhelming to them, and deadlines become part of the story because as you near the deadline, there's more adrenaline, more dopamine. That drive to succeed comes stronger, and so you might see more late nighters being pulled. And without a doubt, you can't go too far in life without effort. But the folks with ADHD, especially if they're not treated, not supported, not helped, they will create these structures in place, the systems in place to succeed, and they'll work very hard at it.
So you kind of already touched on this when you were answering the previous question, but can you maybe elaborate on what some long-term mental health effects or just negative effects that can happen when someone spends years compensating for unrecognized ADHD symptoms?
So I'm going to assume the question also has to do with untreated ADHD symptoms. So and I can't say this is going to happen to everybody, but I will say that there are higher risks of certain things happening with untreated ADHD. So if you look at populations of untreated ADHD, not the high functioning, not the high intelligence, but just populations, you will find that folks with untreated ADHD have shorter uh, college degrees. They spend less time in college. They more frequently going to lose jobs or switch jobs, and their income levels are less than those without ADHD. Uh, in folks with untreated ADHD, highly intelligent and average, there's untreated will lead to a lot to anxiety, depression, burnout, low self-esteem. They're asking the question, why is it so hard for me compared to somebody else who's just, breezing through life? They may struggle in relationships. This is where things like uh, impulsivity may come in. Um, uh, People with ADHD a lot of the time struggle with sleep. And so it may be because they're on their smartphones and looking at social media and hard to turn these off. They may struggle to get enough sleep. They're at higher risk of substance abuse. So alcohol, either binge alcohol drinking or becoming um, excessive alcohol use, drug use, running into legal problems anywhere from driving while intoxicated to speeding tickets, and so there's a cost to untreated ADHD. This is not the majority of people with ADHD, but people with ADHD struggle in life if they're untreated, and uh, even those who are the silent ADHD, most ADHD is untreated. People with ADHD want to think of themselves as normal and not having a problem. Their self worth is linked, like a lot of other people, to success, and they might consider themselves as a failure and things like that. So they don't often show up for treatment until they really hit the wall as adults.
Okay. And for our last and final question, so for someone who's experienced these patterns, whether they're a student, adult, or a parent, what is a healthy first step that they can do in order to maybe uh, to kind of offset these challenges that they might have?
This might be my longest answer of all because I want to be helpful to whoever's listening to this podcast. You
Yes,
know,
of
the
course.
first, yeah, the first thing I think is for people to learn about their conditions. Okay. So if people specifically wanted to research ADHD, the website chadchadd.org is a pretty good website. Um, Before I actually answer this question, because there are people who are thinking they have ADHD. There are people who think they have ADHD, but they don't have ADHD. There are people who don't think they have ADHD and they do have ADHD. So I don't. People need to kind of shouldn't assume that they have ADHD without this diagnosis actually being confirmed. And some of the self diagnosis websites for ADHD are quite inaccurate because for the difficulties with attention concentration, uh, impulsivity, even hyperactivity, there are multiple causes to include food. And there are concerns about food additives, poor nutrition, certainly poor sleep, marijuana use, uh, uh, poor support at home, multiple different causes. But I'm going to get back to your question, and let's assume that this person now is likely to have ADHD. So the first thing is to see what kinds of things can I do uh, to help me succeed. So learning about the diagnosis, and that's where the website chad with 2ds.org is a good one. Those who for certain have been diagnosed and are in treatment, I would say there's a very good magazine called Attitude, ADDItude.com, that attitudemag.com, sorry, that has a lot of self-help tips on how do you manage your emotions, how do you manage your time, etc. It's a pretty reasonably priced magazine. So I'm going to go through some things which are in the self-help domain that are critical and helpful to the person who has ADHD. And at the very, very top, I'm going to say sleep. Okay? Now, sleep is important for all animals, all human beings, but particularly so for people with psychiatric conditions, and ADHD is one of the neuropsychiatric conditions. So ensuring that this person gets, let's say, 8 hours of sleep. There's usually the range 7 to 9 hours of sleep, but you want to shoot for 8 to 9, not the 6 to 7 or 7 to 8. Trying to get good sleep would be the very first thing that I would say. The second thing would be exercise. Regular physical activity is one of the most powerful interventions to help people with memory, to help people with anxiety, to help people with insomnia, to help people with depression, and to help you focus, to help you remember. So a lot of memories get consolidated in sleep. Increasing blood supply to the brain helps the brain function well. So exercise, number 2. Number 3, nutrition. Okay, there's been a lot of focus recently. The new dietary guidelines have been released, and so sugar, processed foods are to be minimized. More fruits, more vegetables, more healthy foods are to be prioritized. Okay, and sometimes this is one of those things that takes planning, especially when people are going out to college. Having your next day's breakfast and lunch made the day before makes it a lot easier the next day, and even for folks like you who are in school. Okay, number 4 is being very careful with alcohol and drugs. They're everywhere, they're easy to get. You don't have to be 21, as you all know, to get this. And this can really derail a lot of things in the person trying to succeed in life. So, number 5, I wrote video games and smartphones and notifications, and there's so much exciting stuff out there that is competing with your focus, your goals, your where you want to be. And the person, this is very simplistic, okay? That that ADHD, there's a dopamine deficiency, and Ritalin and Adderall increase dopamine. It's a lot more complex than that. But it's quite easy to understand that if I have physics in front of me, and you're, let's say, a football lover, and you got a football game and the score's going off on your right, you're going to struggle to pay attention. So keeping some space between you and the smartphone, maybe the smartphone outside the room or notifications turned off, and being careful with things like video games that are very addicting. I mean, I'm not saying no to any of these things, but being able to maybe set a timer, set an alarm so that you don't get sidetracked and forgetful of time. Um, Keeping things like keys, phones, wallet in one place. I'm sure all of us have lost our items. Where are my keys? Where's my wallet? Where have I kept this? So having a system in place makes life easier. For me, all these things go into my knapsack. So I don't lose my access card, for example. Okay, for the issue with time, which is one of the very critical aspects with ADHD, you lose track of time. Uh, some people have advocated having a watch. I'm not exactly sure. I have a watch, yes, but I literally have barely any notifications turned on here. Yes, I'm aware of the time. I can check the time, but having multiple clocks around wherever you are living, wherever you are, working or studying, helps you become aware that there is such a thing as time. We've talked about alarms, calendar items, reminders. I tell my patients to use paper and to have checklists and a planner and to put lines through items on the checklist when they're done. Because I think that physical reminder of something on paper is helpful. Can it be done on your phone? Yes. And there are some people for whom it works, but for those for whom it doesn't work, good old planners and paper can work. I want to talk about driving. People with ADHD are at risk of accidents. In fact, people with ADHD have a higher mortality. They die. And the biggest cause of their deaths, early premature deaths, is accidents on the road. Okay, and what drives the accidents on the road? You got to be at the place in time, and you've started late. You've gotten up late. You're rushing, and nobody likes to waste time, but nobody wants to be in an accident either. So setting 10 minutes, let's say, of a cushion so that you don't drive over the speed limit, or you don't get the ticket, you don't get into an accident, you don't brake suddenly and you get hit from behind. I think driving is one of the things I thought is important to bring up today. One of the difficulties is getting started, right? Uh, the person with ADHD wants to study for the exam, but they keep putting it off, and they have that from neutral to first gear, that first start is a challenge. Okay. Now there's a lot that can be said on the topic of motivation, and a lot of people choose to start closer to the deadline, or they kind of trick themselves with a false deadline. For example, let's say I had to prepare for this podcast, and y'all had told me about this 2 weeks in advance. I would say, be ready a week ahead of time. And then, so can you get excited to get started is the key. And starting too late will affect your performance. So factoring in time and setting a deadline earlier than the actual deadline will help some people. Okay, so I'm almost done here. Want to talk about two things: academics and careers, because I'm thinking that some people in the audience are going to head off to college soon. Um, we know that people with ADHD can actually pay attention and focus and stay on it, maybe even longer than other people, if it's a big if they're interested in it. Okay, so to somebody who has difficulties, focusing, paying attention, all of that, please take courses that interest you. Okay, that will make your life easier. Okay, um, and then I want to go to careers. Now, this is a very broad topic. There are an enormous number of careers, and one needs to look at one's strengths, but also one's weaknesses in trying to figure out which path are you going to go. Some people like challenges. Some people like flexibility in what they do. Some people like more physical jobs. Some people like to be in high pressure situations. So try to find what is it that uh, really interests you in what you like. One of the things we haven't talked about today, and it's from research that was released 1 year ago, is that ADHD, while it's a chronic condition, it often persists beyond the age of 18. It fluctuates. It may almost go into remission, and then somebody may find themselves in a job where there's a lot of spreadsheets and the ADHD surfaces. Or they may find themselves married and the ADHD surfaces. Or now there's a new child or a second or a third child and the ADHD surfaces. So the what ADHD researchers would say is paying attention to the environment and having a fit with the environment, just like a fit with the career, fit with courses that you take, is going to be important in reducing. I think Nikar had asked about the long-term consequences of untreated ADHD. By these all non-medical ideas that I've been putting forth, they can help you just have an easier, less bumpy ride through life. Then, of course, there's treatment and professionals and money involved from ADHD coaches who will check in with you once a week or twice a week for money and say, all right, you told me that at the end of January you have a test coming up. We're now in the middle of January. Have you started studying? How are you going to study? And how much time are you going to study for this? And how are you going to remind yourself? So there are people who charge. I think the going rate is somewhere around $150, but you'll find cheaper and more expensive, who can be an ADHD coach. The other is learning coping skills from a therapist. Now, this is slightly harder to find, but it's discoverable of people like psychologists and other therapists who know what are the challenges of life with ADHD, whether it's in the classroom or the job or relationships or personal care and money management and all that stuff, and will help you. And then there is medication treatment, and that's a whole lot, another conversation. I'm happy to talk about it if there's time and if there's interest, but medication shouldn't be the last resort, but it shouldn't be the only resort.
Well, thank you so much for giving us such a deep insight into ADHD, all its nuances, and healthy first steps that anyone listening might be able to take. And thank you so much for your time today, Dr. Voss.
You're welcome.
Yeah. Thank you for being on the podcast. And so I think we're gonna end our podcast. So thank you for watching, if you're watching, and as you learn about ADHD and high achieving students especially, and if you're really experiencing these patterns, please do take these first steps as this doctor has said. So thank you for watching.